Developing now, COVID crush.
Case numbers growing along with concern for children.
Have you heard of Flurona? I'm Ian Margol with the combo doctors are now seeing in kids.
Developing now at 6, growing concern for children during this COVID crisis.
There's a scary new combo tonight. Kids suffering from both COVID and the flu. Let's get right to Local 10's Ian Margol live at JMH with our top story. Ian.
What medical experts are saying they are seeing with the Omicron variant is a lot of cases of kids coming into the ER and testing positive for COVID. And now we are also in flu season, which complicates things even further.
It sounds like a monster, Flurona.
A dual diagnosis of the flu and COVID-19, sometimes called Flurona, is now being seen in South Florida.
Saturday morning, she woke up with 102 fever, moaning and groaning in pain.
Anna, who asked us not to show her face or give her last name to protect her family's privacy, tells us her 6-year-old daughter has officially tested positive for both, one of the first publicly confirmed cases in our area.
I'm willing to raise my hand and say, hey, there is one. It's not to be hush-hush about it. It's just like to sort of get people on the ball of understanding that there's like a new thing out there.
Right now, pediatricians and children's hospitals across South Florida are seeing the highest number of positive COVID cases since the pandemic began. And now, with flu season here, there's even more to be cautious of. Dr. Jorge Perez is a pediatrician with Kidz Medical Services.
During the winter months is when we start seeing the flus, especially for influenza, RSV, things that are common in children. A lot of these kids are tested. Some of them are coming back positive for both influenza and RSV and COVID.
Dr. Perez says anytime a child is brought in for medical care right now, they are tested for all respiratory viruses. And while their symptoms might be hard to differentiate between, you can take the same steps to avoid all of them.
Good hand washing, masking, social distancing. So I would continue to follow the same thing that we've been following for the last now going to be on 3 years, basically.
So here's the thing, kids that are having COVID right now, most of them have mild symptoms, but the ones that are having stronger symptoms, things like respiratory symptoms, those tend to be kids who are 5 years old or even younger, down into 2 years old is what they're seeing right now. And those kids are not old enough to get vaccinated. So the best way to keep your kids safe, obviously wear those masks, hand washing, social distancing, and get your vaccines and your boosters to make sure you don't get it as well, or at least get a much lesser version of that virus. Live in Miami, I'm Ian Margol, Local 10 News.
Good advice there. Thank you, Ian.